Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
All right, what's up, guys? It's Erin Falls, one of the docs at Wild Health. Here today, super excited for this interview. I've got Dr. Tommy Wood with me to talk all about brain health and cognitive sharpness. So he's a physician scientist and performance coach with a super remarkable range of expertise. He completed his medical degree at the University of Oxford and earned a PhD in physiology and neuroscience at the University of Oslo. He's now a professor of pediatrics and neuroscience at the University of Washington, where his research focuses on how the brain develops, adapts, and recovers from injury from newborns in the NICU to adults across their lifespan. Beyond his work in research and academia, he's worked with high-performing individuals, including Formula One drivers, elite athletes, and entrepreneurs, helping them optimize their body and brain. He's published extensively and lectures all over the world. He's passionate about making the science of brain health practical and accessible. So I'm really excited to explore some of the science behind some of this, as well as the strategies you've spent your career studying, from everything from brain injury to performance and aging, and really talk about how our audience can use some of this to really practically apply this knowledge so they can live a healthier and cognitively sharp lifespan, right? So I think that's kind of the meat of it that a lot of people are going to be interested in today. So I'm really excited to have you on.
And I'm really excited to be here. Thanks so much for having me.
Yeah, cool. I hope I got all that right. You've got such a broad background. I was fascinated learning about it. So please correct me if I got any of it off.
No, you did a great job. That was you're right. I have an eclectic CV. That's what I'm told. So no, that was perfect.
It's cool. It's cool. I mean, it's super focused in brain health, right?
Yeah.
And you've really gone to all the angles of it, which is so awesome. Cool. So it's a unique background. It's a diverse background. Even working with Formula One drivers, right? From the NICU to car racing, right? Super cool. What pulled you into the field, just out of curiosity?
Yeah, it's a great question because I've ended up as being this neuroscientist who does all these various different things related to the brain. But I came to neuroscience actually very late. I never really planned to get into neuroscience, but it sort of mirrors some of my trajectory throughout my own life. So when I was an undergraduate and then in medical school, I was a rower. So I spent a lot more time rowing than I spent studying. And I was particularly interested, as I sort of learned about health and fitness, and I started to research that for the rowers that I ended up coaching, and so then that was kind of what led me to medical school. And there's been this kind of two parallel tracks. I've been increasingly interested in health and performance, and that's where I do some of my elite athlete work. But then I also, when I was so I spent a couple of years working as a doctor after I finished medical school. And then I didn't really know what I wanted to specialize in. The system is slightly different in the UK, where you specialize later. So you sort of come out of medical school and then you spend several years doing rotations through different specialties, and then you start to specialize. But I didn't really know where I wanted to specialize. So I got this offer of a PhD to go to Oslo from a previous professor that I'd done some work with as an undergrad. And that was where I really started to specialize in neuroscience. But it's, again, sort of very niche, right? It's neonatal brain injury, which is actually very common and incredibly important because it affects the entire lifespan of these kids and their families. But nobody really studies it, which is kind of surprising. There's 10 or 12 labs in the world that really focus on neonatal brain injury. But then as I did that, I'd moved away from being a doctor and on night shifts and busy all the time, and I could sort of like sit down and read PubMed and get also spend time thinking about health and performance and these other things that I'd been interested in from a much more scientific standpoint. So these kind of strands then continued, right? I did a postdoc and I became a faculty where you're sort of a professor studying these things, and I'm still running a lab that studies these brain injuries. But then I also continue doing this athletic stuff. And then over time, it just seems like all this stuff sort of makes sense together, right? I'm interested in traumatic brain injury because it affects athletes, and it also affects, military groups that I do some work in, and all these things that people need to perform at a high level, but they're also at a very high risk of brain injury. And what you see is, therefore, from all these different strands, the same things come up again and again and again. So what's important for initial brain development in a baby after a brain injury, for instance, or just brain development in general, is very similar to the things that a brain needs if it's recovering from a TBI, is very similar to what a brain needs if it's then trying to stay sharp and as healthy as possible for as long as possible into like 7th, 8th, 9th, 10th decade. So it took me a long time to figure it out. Maybe like it's you sort of say you can kind of see all these strands come together, but it took me a long time to figure out that, actually the stuff that I do with Formula One drivers also kind of makes sense with when you're then trying to translate it to people who want to prevent cognitive decline. And it's kind of nice how all those different pieces kind of came together over a couple of decades.
Yeah, sounds cool. It sounds like there's a lot of personal overlap for you with the athletic background and everything else. How about the pediatrics part? Do you have little ones, or did you just happen on this? Because like I have always found, I do have a child, but I have always found that like pediatrics is really interesting because it's like a fresh template, right? Like it's like a blank canvas. It's very different than I practiced hospital medicine in adults for a good period of time, and there's so many things coming together. There's so many injuries at the same time that are influencing one another, and inputs from the environment over so many years. At that point, pediatrics is such a unique perspective from that point. I'm just personally curious what brought you into that part of it.
Yes. So my wife and I, we don't have kids. We have boxers who are
nice. They're kind of kids, yeah.
just as demanding.
Totally.
I think. But yeah, so that was really one area. That was the pediatric or the neonatal side was really what got me into neuroscience. But I essentially just kind of fell into it. Like there was that point in my life where I didn't really know what I wanted to do next, and somebody was like, "Hey, come to Norway and do a PhD," and I was like, "Oh yeah, that sounds interesting." So that's what I did, and then you kind of see that it's like a small field that's doing really important work, and especially because often this was a normal, healthy pregnancy, and we like. Just something happened right around birth, and now this baby has a brain injury, and we have to try and find ways to treat that because you're right, it's like the blank slate right at the beginning of life. We know this affects the entire lifespan, but there's not that much money in it. It's sometimes it's hard to, if you're trying to develop new therapies or drugs, right? A lot of drug companies who are working in the like neurology space. They're working on dementia and neurodegenerative disease because like those are kind of the money makers, and I don't mean that in a bad way. It's just this is
totally
this
it is what it is. Yeah,
it is what it is. It's how the world works. So it was that kind of stuff that really kept me in it, because I thought we were developing good models, good ways to develop new drugs, repurposing old drugs that works well in this arena because then they're cheaper. It's easier to get things into babies. Like getting new drugs into babies is really tricky, as you can imagine, because everybody's very risk averse. So there was a lot of space to innovate in that arena, and it's a really important problem. So those were some of the things that kind of got me into it and then kept me there.
Yeah, I as a NICU mama, I'm grateful that mine's like yours, who aren't maybe totally indoctrinated into how the system works, right? Like you obviously look outside and do other things as well, and look forward into how these things are going to affect little ones later and how the brain evolves. Like it's special to hear that you're in the field. That's really cool, because I don't think anyone would be surprised to hear it takes a long time to make changes in the medical system. And that's no different in the NICU. Like there's like a way things are done. Yeah. And it's beautiful in so many aspects. It's a radical place to be. The people care so much, and there's such amazing acute care and systems in place for those things. But some of the things I found so interesting. My son was there for almost a month, and like people were like, why don't you just go sleep? Like, why would you breastfeed in the middle of the night or pump in the middle of the night? Like, and it's not that important. We can give him formula. Just go get your sleep. And I'm like, this is like his first days of life, and he just had gut surgery. Like, why would I not give him the best nutrition possible? And it's almost like it makes too much sense, right? But just knowing that there's like scientists on board that have this mindset, it's really special, just from a personal perspective.
That's so that particular example is something that's changed a lot in the field recently. Like now there's this huge, I have several colleagues who this is their area of expertise, like this huge interest now in breast milk. And so like mother's own milk is the first thing as early as you can give it, as soon as you can give it. Obviously there are some things that, if you've like surgery or that might prevent things by a few days, but the sooner the better. We're extracting different things from breast milk that might have neuroprotective properties, but that because it's like really accessible, right? You have a baby who has a brain injury, right? You have the source of the treatment right there if it turns out to work. So it's a really exciting area.
It's like the OG, precision nutrition, personalized nutrition, right?
Yeah,
changes second to second.
Yeah.
Super cool. Really rad. Well, love hearing about your background. Let's talk about what's up and coming for you too. I know you've got a book coming out. I would love to hear a little bit about it. And it kind of segues into, I think one of the things that, at least from the interviews I've heard with you, is, a theme throughout your work is how important like new stimuli are for brain. So maybe I'm getting this wrong, but I'll let you take it away with the new book, whatever you want to share about it.
Yeah, thanks so much. This is that you definitely got it right, and I think this is something that's also translated very much from the work in the neonatal space, and then across the entire lifespan, all the different groups that we work in, and including cognitive decline and dementia, or dementia risk at least. So the book is called The Stimulated Mind. It comes out next March, but I will say that pre-orders are really helpful, so you can go to thestimulatedmind.com and order it from your favorite place if you're interested, and I'll hopefully tell you more about it that will get you excited to read it. So the core thesis is exactly what you said, which is that the function of the brain, first with development in babies and kids, and then as we go through adolescence, as we go through education, as we go into work, as we think about our long-term trajectory of cognitive function, as we get into our, last several decades, the function of the brain seems to be really driven by the stimulus and the stimuli that it receives. So the way that I kind of explain it to people, and this is probably the way that I like it, because I'm a meathead and I like to lift weights in the gym. So the brain is a lot like a muscle, like from the biochem, like not structurally, right? The cells are largely made. There's a lot more fat than there is, muscle tissue, but sort of biochemically and the way it responds to stimulus, you see so many overlaps. So if you think about, you want to go and get stronger, you want to go, you know that you need to lift weights, or you need to apply some resistance to the body, some mechanical tension, right? That's the stimulus for muscle growth. You can augment that process, right? We need good nutrition. We need good sleep. We probably want to avoid a bunch of stress and these other things that might prevent us from getting the maximal adaptation to the stimulus that we apply. But if you want to get stronger, you have to lift weights. That's the rule, essentially. And the brain seems to be the same. So we know, right, sleep is critical, nutrition is critical. But if you want some area of the brain to be plastic, right, have this idea of neuroplasticity, new connections, new skills, the thing that you need is stimulus. You need to provide a stimulus to tell the brain, I need you to change. And so that's the primary driver of function. That's also the primary driver of maintaining the function of those cells. So if you look at all the hallmarks of aging, like problems with mitochondrial function, inflammation, problems with like protein handling, proteostasis, all of those things are managed by stimulus. And it's the same in muscle tissue, right? If you stimulate a muscle, it starts to initiate autophagy. It starts to initiate all these different processes of maintenance, and the brain seems to be the same. So the most important thing you could do to anti-age or prevent the aging of your brain, as well as developing and maintaining a specific function, is to apply a given stimulus. And then it's very important to support the adaptation, where it's sort of like sleep being really critical. But the kind of the core idea of the book is how important it is to engage our brains in things that then drive these aspects of function and maintenance that will allow us to remain sharp for decades to come.
And when you say stimulus, I'm guessing it's maybe a combination of new cognitive loads and actually learning new things as well as different sensory inputs.
Yeah, so all of this starts to play a role. And I think some of the easiest ways to think about it are based, again, on the sort of like the early part of our development, say the first 2 or 3 decades. So when, and you'll find this interesting, so maybe we'll start right at the beginning. So when you look at the development of brains that have had some kind of issue right around birth. So I work a lot with babies born preterm. And so if you're born early, the more early you're born, the more likely it is that you'll have some kind of cognitive impairment later in life. And the more early you're born, the more likely it is that you'll experience dementia earlier. We're just starting to see this now because the first babies that were born very preterm only really started to survive like in the 70s and 80s.
Yeah.
Right? So now they're getting to the age where they might experience dementia. But some of the work that we've done looking at these big data sets that we have of babies born preterm is that of all the things that happen to these babies, and so you mentioned gut surgery. I'm not sure what it was, but like these babies get a lot of gut issues. There's something called necrotizing enterocolitis, which is very common in babies born preterm. They need surgeries. They get brain bleeds. They have issues with their lungs, with their eyes. They get tons of drugs, opioids, benzodiazepines, all these things just to try and overcome some of the issues that they're experiencing in the hospital. The most important thing for these babies' cognitive development is the home environment. Regardless of all those things, it's the environment, it's the home that you go to. So I spent a lot of time trying to help improve therapies in the hospital, but actually what really sort of overwhelms all of that is the home environment. So one way to measure that is parental education. It's a rough proxy of all the things, but that tells you something about what they have access to, the kind of food they're going to eat, the kind of stimulus they're going to get. They're more likely to get read to, or like all these other things that kind of make up the environment. That's what's most important. And so this then translates across the rest of that developing person's life. So you see that the longer somebody spends in formal education, the higher and the later their peak of cognitive function on average. So this tells us, or tells me, that the more stimulus and support that you get from your environment, and then this formal period where all you're doing, it's like as a student, right? So if you go to high school, then you do undergrad, and then you get a graduate degree, right? Each of those slowly seems to push up your total kind of capacity of cognitive function, because you're just a professional learner. That's your day job, is learning. And as you do that, you're stimulating, that's my idea of stimulus, right? That sort of learning environment. And then that's pushing up that kind of window of cognitive function. So then when we look later in life, we see things like the more stimulating or complex your job is, right? Is it socially complex? You have lots of people you have to interact with. You're constantly having to solve problems? Is it very varied, rather than being sort of very repetitive? Those people who have more complex, stimulating jobs have a lower risk of dementia and a slowed rate of cognitive decline. But it doesn't have to be work, because people can get this from hobbies. They can get this from learning other skills. You can see basically any complex function or skill that we would choose to do as humans seems to be protective, probably because there's a social component, probably because of all the different inputs that we're receiving. And then the other side of that kind of comes to what you were mentioning, which is that people who experience sensory loss, so they lose their eyesight or they lose their hearing, they're at an increased risk of dementia because they're losing those stimuli, both the like direct inputs into the brain, but as you start to lose your sight or your hearing, you don't go out and experience new things. You don't go out and meet and spend time with people because it's very difficult and it's very uncomfortable. So all those different like huge epidemiological pieces of information kind of come together to say that the amount of time you spend learning and engaging in the world are the primary determinant of how your brain is then going to function.
That's so cool. I mean, essentially, it's peaking as your stimulus is peaking, right? Like your capacity of cognition. That's pretty rad. I see it in real time. My kid's 12 months old now, and I do a lot of traveling for health talks and different things. And he typically comes with me, part of the package deal. So since he was little, he's been traveling around, and literally every time we take him on a new trip or do something where there's like wildly new inputs for him, he's around new people, he's around new things, he has this explosion of language and new skills like every single time. And obviously his little one's brains are rapidly changing. It's different, I'm sure, on a lot of levels than our age, but it's really cool to see in real time. Like one time we were flying from San Francisco to New York City and a nonstop flight. He's like 7 months old. And by the end of that flight, he had learned to say hi and wave because so many people that were going by were waving to him, right? Like the whole time. And so that whole trip, he just practiced waving. So it was really cool to see the brain like firing. And my husband and I have noticed that. We're like, man, every time we do something new with him, he's just like, so many new skills.
Yeah, that's so cool. And I think that it's a really that example of a developing baby and toddler as he gets older, I think is something that we as adults need to spend more time thinking about and emulating as much as we can. Because if you think about how he engages with the world, he is constantly trying new things. He's trying to get inputs. He's trying to learn and like have his brain. Like the human brain is more shaped by the environment around it than any other brain, and it's like by design or whatever term you want to use. And so you can see, right? You can literally watch him doing it. And that's going to involve him trying stuff and failing. He's not going to say his first words very well. He's going to stand up. He's going to fall over.
Oh, yeah. The first waves were toward his face for sure for like a week, right?
Exactly. But there's this, like the brain is just like, at that age is craving inputs. It's just like, I want to learn all these things. And I'm going to go out and I'm going to try it. I'm going to fail. And then I'm going to nap. And then my brain is going to process all those things. And then I'm going to go and do it again. Whereas as we become adults, and I think this is part of the thing is you're right, that as we get older, so the brain, reaches its final form, depending on how you want to measure that, sometime in your mid-20s to early 30s. Basically, if you think about the average human lifespan, we've extended it now sort of on average with like good medical care and that kind of stuff. But the human brain spends about 50% of its life developing until it's kind of finished. But even once it's finished developing, it still has the capacity for neuroplasticity to learn new things and sort of like keep building and shaping itself. And there are lots of like randomized controlled studies that show that. You see it on MRI scans. As people learn new skills, those parts of the brain change their shape and function. But so we've kind of told ourselves that we kind of get past 20 or 30 and then the brain is fixed and there's like it's harder to learn new things and we can't really adapt or learn the way that kids do. But actually it's maybe a little bit slower, but we can actually do it. It's just that we don't have time, right? We're busy. Like we're not spending 8 hours.
Or we're like scrolling our phone while we're learning.
Yeah. So we're doing other things and we're busy and we're stressed. So when you think like, oh, my kids pick up languages so much faster than me, I was like, well, yeah, they're spending several hours a week doing that and they're not doing anything else. So we do still have this capacity. So one is we tell ourselves that we can't do it. Our brains are too old. It's too late when it's probably not. And the other one is that we lose the ability to just try stuff out and fail at it, because adults, like, we hate being bad at things, right? And we hate other people seeing us be bad at things. Your son doesn't care if other people see him fall over on his butt, right? Couldn't care less. So there are some of these elements that I think we can leverage as we then try and continue to build skills and maintain our function later in life. Because the brain, some people think about brain aging as this continuation of brain development, and actually aging is just like a continuation of the processes of development. And the majority of brain development as we get sort of past 2 or 3 years old is actually the brain pruning connections and cells that it doesn't need, right? It's not growing, it's down selecting based on the inputs that it receives. And so the brain continues to do that. So if we're not continuing to give it exposure to these different things, it will just be like, well, I don't need this bit because I'm not using it. And so that, I think, is part of why we see decline, is just because we stop using our brains in the way that kind of promotes this ongoing maintenance of those different functions.
Yeah, that makes perfect sense. What kind of stimuli if people are just learning about this for the first time? I mean, I think people might have a good understanding of, like, yes, trying new things. But are there like some go-tos for you? Like, are there specific like brain exercises, or are you talking like learn a new sport, or what kind of action steps do you tend to give people? Not to give a spoiler alert for the book. Read the book, please, everyone.
No, there's no matter. I'll give you all the answers, but the book will have a lot more. It's like there's nearly 2,000 references. People can like really dig into it if they want to.
Yeah.
But I think the nice thing is that when you look at across all the studies that are available, both interventional studies where we're actually randomizing people to different interventions, or just observational studies looking at what people do in relation that's then associated with a slower risk of cognitive decline or better cognitive function later in life, it's super varied. So one thing that you see fairly frequently is that people who do a number of different things, so some variety, seems to be beneficial. But beyond that, I try and think about what are some of the core ways that humans uniquely often interact with, like, how do humans uniquely interact with the world, and like what are some of the like very human skills. So learning new languages, learning complex movements and sports. So like dancing seems to be the one thing that kind of comes out above multiple other forms of exercise. And I say this as somebody who just like at this point is like really cringes anytime I think about having to dance. But it's got like a musical component. Music is really great for the brain. A social component, complex skills, physical activity. Like if you look at cognitive function, if you look at mental health, dancing seems to be pretty magic. But any what we might call coordinative or open skill sport or movement probably has similar benefits. And these are usually social sports as well. So team sports, ball sports, probably board sports, but then also yoga, tai chi, some of these other things that require sort of complex motor movements. But you even see it in like obstacle course races. You can kind of look at, if you compare somebody who runs an obstacle course to somebody who runs just around a track, the obstacle course seems to drive more of these changes in terms of that might support brain function. So any of these complex movements, and then playing music is another one. So languages, music, complex movements. Those again and again really seem to be these core components of skills that seem to be beneficial. But reading, which we do less and less of nowadays, according to the latest numbers. Some, like puzzles and games and things like that can be beneficial, but there was this idea that as you retire, you should just like take up Sudoku and crosswords and that kind of stuff. And it's a nice idea, but there's been some interesting work by people like psychologist Gloria Mark, which showed that kind of activity, say like Sudoku or a crossword, or something, you're on the New York Times kind of puzzle app, which I do frequently because I like it. It's an engaging activity, so your brain feels engaged, which is a nice thing, but it's not very challenging. So it's more like a kind of a meditation or a slightly more relaxing activity that still engages your brain. So it's not providing that stimulus. If you really want to stimulate the brain, is the word I use, it needs to be challenging. So you need to have a high risk of failure and probably be failing at something, because it's the failure that tells the brain that it needs to stimulate neuroplasticity in order to change so that it doesn't fail in the future. So then there are a lot more like new technologies that are coming on. So some of the brain training type like apps and programs do have some evidence for them. The one that has the best evidence for it is Brain HQ. And Brain HQ uses, or one of the games that it has, Double Decision, was used in what is probably still the best brain training study that was done in older adults. It was done in the 90s now, but there hasn't been a better one since. So this was the ACTIVE study, where they took more than 2,000 people. They randomized them to multiple groups. So they had a control group. They had a processing speed training group. They had a memory training group, and a reasoning training group. And the processing speed training group is now what's used in this in Brain HQ. I have no relationship with Brain HQ. They have the best evidence for their intervention. But what was fascinating about the ACTIVE study is that several years after these older adults, in their 60s and 70s, did just like 10 weeks of training, they saw improved quality of life, and decreased car accidents and multiple improvements in the sort of activities of daily living, or maintaining activities of daily living, after just like 10 weeks of brain training across those different groups. And the processing speed group performed the best. This is like several years after, like 5, 6, 7 years after they did the training.
Cool.
So most people will say brain training doesn't work that well, and a lot of the brain training that's out there isn't very good. But things like the ACTIVE study do tell us that actually, if you do the right kind of training, and I think processing speed training is good, because that's one of the things that really declines, or can decline, as we get older, and that's what might prevent us from driving and doing all these other like complex activities that require us to sort of be alert and interacting at speed. So brain training is an option. I do more and more work in the sort of training in the virtual reality space, and I think that has a lot of promise, mainly because you're stimulating the brain from multiple angles in the way that it normally receives information. So if you're doing brain training on a flat screen and you're kind of clicking it with your mouse, like, that's good. But if you can put that in an environment where you've got visual stimulation, you can do physical movement, you're also getting auditory stimulation. Now you're much closer to the kind of stimulation the brain expects when it's developing.
Mm-hmm.
So that's a very early. We're still kind of working on that, but I think this kind of stuff is going to get better and better over time.
Yeah, I mean, my husband has a racing simulator. I mentioned to you, he's in car racing, and he's told me numerous times, I've gone on that thing and it's like a little overwhelming, and he's like, it's pretty accurate, like, these traps are very similar, and it doesn't, I guess you're probably not feeling like the G-forces and things, right?
Yeah.
But there's a lot of different like stimulation coming at the same time, right? So super cool. And he's had that for ages. I imagine, that's going to get like more and more advanced pretty quickly.
Absolutely. Yeah.
So super cool. So you're kind of getting at how to optimize brain health and prevent decline. This is a subject matter that is really popular with our audience. A lot of people have maybe gotten a 23andMe done and they find out they have an ApoE risk or something similar. They've got a family history of dementia. There's a really common thread of patients and listeners that are looking to, prevent cognitive decline. We also have a lot of athletes in our population. So there's a good amount of history of traumatic brain injury that, people may have had. So I'm just curious, like, if we could dive into this general concept. This is a massive concept, obviously, or massive subject, but one, what your thoughts are on, inevitability of decline, especially with certain genetic risk factors, and then some some of the most helpful things you see in terms of like optimization if known risk factors do exist, other than obviously stimulus, which we've, hit on a lot.
Yeah. So I'll expand out from stimulus to give you my overall framework of how I think about these risk factors for cognitive function or cognitive decline and dementia, and then where people might sort of focus based on their own risk, right? Because there are several people who, they got graduate degrees and they have very complex and stimulating jobs, and they have, they drive simulators and they learn languages, right? So like the stimulus box is ticked, right? We don't need to worry. But there are other components that are going to be important as well. So I have 3 buckets in what I call the 3S models. The first bucket is stimulus. We've talked about that. And then the next 2 buckets are supply and support. So when you stimulate a tissue, including the brain, so when you stimulate a network in the brain, there's this thing called neurovascular coupling. So those neurons and astrocytes and all the other cells around it become active, and then they draw more blood flow to that area. And so you need a good supply of the things that those brain cells are asking for as they become activated, like those networks of the brain. So that includes a good supply of oxygen and some kind of nutrient metabolic substrate, as well as a supply of the nutrients that are required to make membranes and mitochondria and synapses and all those things. So good cardiovascular health is critical, right? You need those blood vessels to be functional, flexible, responsive to demand. Then you also need good metabolic health, right? Because you need substrate to be delivered, be that glucose, ketones, lactate, whichever is your favorite substrate based on how you eat and move. And then you need good nutrient status. So we know there are several nutrients that are critical for long-term brain health, several B vitamins, and omega-3 fats, iron, vitamin D, magnesium. Those are probably like the big hitters. There are several others. We know that antioxidant polyphenols become very important, as do other antioxidant vitamins. But those are like some of the heavy hitters. So that all fits into our supply bucket. If you want to respond to a stimulus, you need those things to be delivered and quickly. So that's where the cardiovascular health becomes important. And then if you want to adapt to that stimulus, you need a period of recovery. In sort of exercise science, they call this the stimulation recovery adaptation model. It's very similar in the brain. I essentially stole a lot of that when I was writing my book. But so sleep is the most important time that this adaptation occurs. But equally, if we're constantly stimulating ourselves or doing challenging work, even just like micro breaks during the day to like truly switch off, that helps a lot as well. And then we want to prevent or avoid the things that might interfere with this adaptation and recovery process. So chronic stress is a big one. Chronic stress is essentially a hyper-metabolic state in the brain, so you're never actually getting to switch off and recover. And then you want to avoid like toxic exposures and other environmental things that might inhibit that. So very common ones are excessive alcohol, smoking, air pollution. But there's a whole host of other things that could fall into that bucket too. So those are the 3 main areas. And they're all interconnected, right? So when you stimulate the brain, and there are some nice studies that show this, you then drive greater sleep pressure that night. So stimulation brings in more supply. It stimulates later recovery. So all these things are interconnected. Why that's useful to know, rather than thinking about these as like lists of risk factors we have to tick off, is that when you make one shift, the whole system shifts, right? So when you sleep better, then your blood pressure improves, and you feel more empathetic and more social. So you're going to go out and like talk to more people. You're going to give yourself more stimulus. And it's the same, like if you stop smoking, then you're removing an inhibitor from these processes, but also you're then more likely to make other changes, and it's going to be easier to do physical activity, and you're probably going to sleep better. So, and your blood pressure again improves. Blood pressure being one of the most important risk factors for multiple neurological diseases. So, I like to think about it in this way, because you might just identify one thing that's like, oh yeah, this is the area one that is probably a low hanging fruit, for want of a better word, but it's also something that I can make some small changes in, and then the whole system starts to shift. And that's why I like to think of it as this like interconnected network rather than like a list of risk factors. So those are the buckets, and we can definitely dig into the different ones based on what you think is going to be most useful for people. But if we then translate this to those who are at greater risk for one reason or another, either family history or genetics, what's really nice is that consistently across all those areas, we see that the same lifestyle risk factors are beneficial regardless of family history, polygenic risk, or ApoE4 status. So I like it because I can say that regardless of the reason that you have risk, the same core things are going to matter. And ApoE4 is a good example because there are several populations around the world where being either a homozygote or a heterozygote for ApoE4 does not confer an increased risk of dementia. They are the Nigerian Yoruba, the Bolivian Chimene, and several Native American or Indigenous American groups. And you also see this, there's some nice studies looking at people of Sicilian Italian heritage. When they live in Italy, ApoE4 is not a significant risk factor either for dementia or mortality, but then you put them in the US with the same ancestry and they do have increased risk. So all of this, I think, tells us that ApoE4 is just a risk multiplier. It's not it's not a deterministic risk.
What a fascinating way to look at it. We check these in everybody, and I love that term. Not everybody. Some people don't want to know their status here, but I'm going to use that term if you don't mind me stealing it.
Of course, and I think this is really important because there have been some papers recently. There was this big Nature paper that came out last year that basically said ApoE4 homozygotes had essentially it had the same dementia risk as if you had an autosomal dominant mutation in APP or PSEN1 or 2, which is like the familial early onset Alzheimer's diseases. And even if you look at their data, that didn't agree with their statement, but it really made people very scared because it made them feel like there was nothing they could do, even if they were ApoE4 homozygotes. But none of the other evidence supports that. And there are several studies that show that people who are ApoE4 or have at least one copy of ApoE4 benefit more from lifestyle type interventions. So they because you can either see that because they have increased risk in the setting of those risk factors, or because they benefit more from an intervention. So they have greater risk in the setting of poor diet. They have greater risk in the setting of low physical activity. They have greater risk in the setting of excessive alcohol intake. But if you then institute those changes, that risk is mitigated. So I certainly understand why some people don't want to know their ApoE status, and I think this is useful for physicians to know as well, because sometimes people are like, you're in the longevity optimization kind of sphere, and everybody's like, the more data, the better. The more we know, the better. And actually, when you're talking to it like an actual human, they don't always feel that. They don't always feel that way. But I think those who do want to know should be empowered to know that it's multiplying their risk from the environment, but you can mitigate that almost entirely. I won't say entirely because we don't have evidence for that, but I think you can mitigate the majority of that risk by getting rid of those sort of big lifestyle risk factors.
Yeah, we see such similar themes with so many areas of genetic testing. This is just obviously one that, like you hit the nail on the head, can really scare people for some good reasons. So it's super fascinating. So essentially, we're just optimizing. I mean, we're doing this at Wild Health, but optimizing their vascular health, optimizing their lifestyle, optimizing their metabolic health, their micronutrient levels, their homocysteine, their, et cetera, et cetera. And on the other side of that, I think at least personally I could do better at supporting my patients in this stimulation aspect to help with, ongoing cognitive support. And it as opposed to just kind of damage control and prevention, right?
Yeah.
So I love this. And I think it helps, people are busy, time is limited. I
Yeah.
mean, knowing where to put your energy and your efforts, I think can be really helpful in knowing if there is risk amplification in this one area, like maybe this is an area that's really, really prudent to put your efforts, right? So I think that's, can be really, really empowering for people. Very cool. Tell me a little bit about your thoughts on when there is a history of structural damage. Like, is this the same? Do you look at it similarly? Like, really focusing efforts in that area is really prudent in, kind of putting a little more energy into brain health if you have a history of TBI or concussions or whatever it may be?
Yeah. So I think the same core components are going to be important, and plus you may need some additional assessment or input. So often, in the setting of a previous brain trauma, there may also be psychological trauma or other issues that might require some like actual intervention from a professional, and that's important to be that some form of therapy or people with PTSD often have significant sleep issues, REM sleep disorders, things that need to be addressed. And then often, so when I see athletes with concussions, often when they have kind of brain fog, fatigue, it's very common for them to have like oculomotor deficits. So they don't know it, but their eyes just aren't tracking together. And this is a very common cause of like brain fog and headaches and things like that. Those things can be trained, but it just requires an assessment of eye tracking, which should be very easy to get now from a good optometrist or ophthalmologist. And then like specific training protocols to kind of realign. And the eyes are just a neuromuscular system, right? So like any other neuromuscular system, it can be trained. But you just need to know what the deficit is and how to address that. Beyond that, one of the best ways to stimulate recovery, and so like there's actually a meta-analysis that was done by a student of mine. We're in the process of publishing it, looking at different modalities of intervention beyond PT for people who have like chronic cognitive symptoms after a TBI. So like more than a month after a TBI, they still have some kind of deficit, and could be memory or balance, but different stimulating technologies.
And when you say deficit, I'm sorry to interrupt. When you say deficit, you mean neurologic, right?
I mean neurologic.
We see some hormonal shifts. We see all sorts of other things, but you're specifically talking about neurologic deficits after brain injury.
Okay. Yeah, exactly. So that's another important area, right? People with a history of TBIs, hyperpituitarism, they have hormonal deficits. That absolutely needs to be addressed too. So like there are these different areas that people will need to consider. But when we're talking about specific neurological deficits, stimulating activity seems to really be beneficial. And so there's benefits for Tai Chi, there's benefits for virtual reality, there's benefits for like dual tasking, so doing some kind of physical activity like on a treadmill plus some kind of cognitive task. Nowadays it's just recently changed. It used to be that like you have a concussion, you should lie still in a dark room and close your eyes, which actually seems to maybe exacerbate some of the issues because you're not stimulating those tissues to repair. So now graded exercise is really important, just aerobic exercise, and then you can add on some cognitive work on top once people start to recover. But then we published, a few of us published a paper recently looking at, say, supplements and other aspects to help people recover from TBIs. So like if people have sleep issues, then melatonin may be something to consider. Then omega-3s become important again because they're sort of like structurally important for synapses and mitochondria in the brain. Other things like B vitamins and homocysteine status is probably metabolic health really critical. So we know that large swings in blood sugar at least in the acute setting, right? Somebody who's just recently had a concussion, you're trying to at least stabilize blood pressure is important. Trying to maintain thermoregulation is important, so they're not becoming hyperthermic, not getting a fever, because that can then exacerbate the injury. So it might change a little bit across the sort of where you are in the injury process. But those same things become important. You need to stimulate if you have some kind of deficit, assuming it's not one of those other specific things that needs to be addressed in a different way. Some kind of stimulating activity to help drive plastic recovery responses in those areas of the brain, plus making sure that all those other pieces are in place, like nutrient status and cardiovascular and metabolic health are really critical.
Yeah, your other S's. Cool.
Yeah.
Rad. So what about other diagnostic testing that's becoming more available commercially, right? Whether that's measuring neurofilament light chain, p-tau, neuroquant MRIs, like PET scans. I mean, we have patients asking about all of these things.
Yeah.
Do you find these to be helpful out of the research setting and drive like actionable change? Like sometimes we'll see hippocampal volume loss before someone has symptoms, for sure.
Yeah.
Or things of that nature. Just curious. This is your field, and it's a fascinating field for us as providers. So just curious your personal thoughts on it.
Yeah. So we just recently had approval of the like tau amyloid, p-tau 217 to amyloid beta 42 ratio is like a diagnostic marker for potential Alzheimer's disease. It's very good at predicting who's going to have a high amyloid and tau burden on a PET scan, but from a blood test. I think that these things can be beneficial, but a lot of it is geared around biomarkers that can then be tested in clinical trials for anti-amyloid and anti-tau therapies, rather than focusing on what's actually going to, what else could be done to help this individual. When you look at some of the studies for how well these things predict dementia, yes, if you have a high amyloid or tau burden on a blood test, and some of these studies have also included like GFAP and neurofilament light chain and some of these other markers. Yes, the higher you are on some of these markers, the greater your risk of dementia. But there was one study that came out of Sweden, looked at thousands of people, looked at like cutoffs for a combination of these different markers. Even those who were sort of like above their formal cutoff, on a 10-year follow-up horizon, only like 40-ish% of people actually developed dementia. So that was a higher risk than people who had lower levels, but it's really not that predictive yet. It kind of tells you if your risk is higher, but it's not. It's still not deterministic by any means. And I think that's because there are a whole host of things that go into cognitive decline and dementia beyond just amyloid and tau accumulation in the brain, which is what that's kind of focusing on. So these things can be important for some individuals, but I would primarily use them if it's going to help drive behavior change. They are being developed to help drive and track therapies against these different neuropathological hallmarks of dementia and Alzheimer's disease
in known dementia cases.
Well, and so currently in known dementia cases, but people are starting to work earlier and earlier and earlier. So there starts some trials where they're going to try like anti-amyloid therapies in people who are ApoE4 homozygotes and heterozygotes before they have any symptoms, right? In the hopes that they can prevent it. We don't know if that's going to work because historically these drugs haven't worked that well. But there are some groups. So if you look at like Rich Eisen and Kellyanne Yotis's work in Florida, and now she's in New York, their clinics, they do all these markers and then they do these personalized lifestyle interventions, and they're starting to show some data. It's not all fully published, but they presented some of these data that suggest that if you do personalized lifestyle interventions, some of these risk markers come down. So p-tau 217 might come down, amyloid beta 42, or the ratio of beta 40 to beta 42 might come down, or go up. But all of that is grounded in those upstream factors, right? So you're treating high cardiovascular disease risk with blood pressure medications and statins if
we're
necessary.
Coming back to the 3 S's, right?
Exactly. So yes, you can see improvement in these risk markers with some of these lifestyle interventions, but you don't need the risk markers in order to institute those lifestyle interventions. So yeah.
No, go ahead.
So I was just going to say that if a patient wants to know, and knowing will help them, engage in these other things that we know are going to be beneficial, then that's great. But if you go back to this Swedish study that I mentioned, even in people who had low levels of these risk markers, there 5% of them still develop dementia within 10 years. So they have a good negative predictive value, but it's not perfect.
Not perfect.
So again, I would still focus on these modifiable risk factors.
Yeah.
And then, if people want scans and biomarker tests, that's great. But we just need to know like where they're actually useful and what they're actually telling us.
Yeah, and that's not even touching on the potential nocebo effect, right?
Oh, yeah,
if you
100%.
stress someone the heck out, could that be problematic in and of itself, especially if it's not necessarily going to drive positive behavior change, right?
Yeah,
so
exactly.
Super interesting. So like the art of who these are done in. I just had a patient the other day, very strong family history of early dementia, and she's like, I really want to do your program. I'm not super interested in the genetics here. I know I've got a family history risk. I'm really interested in doing everything I can within my control to optimize this. And I think further data is just going to cause stress and probably be problematic for me. And I'm like, perfect.
Great.
So really cool. So I like to do a quick, if you have a couple more minutes, like rapid fire, if we didn't lose everybody with all the scientific jargon in the last question I asked you, to really, I think, get some super quick answers on some commonly asked questions in our population. Like if you were to give me like your most loved supplements versus like overhyped, quick thoughts on like highest ROI exercise for brain health, if you had to pick a couple things, and maybe like how bad is alcohol? Those would maybe be my top asked questions. By my cases, like social alcohol, we're not talking like a case a day here. So just if we could kind of do a little rapid fire to hopefully bring back anyone we just put to sleep.
Yeah, of course. So top supplements. Ideally, you'd have some kind of like basic blood test to know if you need these or not. But homocysteine lowering B vitamins, and like some kind of omega-3 supplement, because now tons of trials show that you need both. Right, you just fix one or the other. You don't. If you fix one or the other, you don't fix it. But together, they synergistically interact. And then probably vitamin D. Those, and like just assuring you that you're not vitamin D deficient. Those are probably my top ones. Beyond that, some of the stuff that I mentioned earlier, magnesium, wild blueberries or like dark fruit. I think they're magic for the brain. And I like honorable mention always to creatine as well. I think it's becoming more and more interesting. It allows us to do more hard work with the body and the brain. So I wouldn't just take it and expect that you're going to get like magic from it, but it allows us to work harder, and we know that work is really important. Right? That's where we get stimulus.
For sure. So, would you say nootropics or ketones overhyped, or you give them a honorable mention?
Nootropics, not many that I would sort of like routinely recommend, because I don't think the evidence is that good, and some nootropics enhance certain brain functions at the expense of others. So like this is definitely the case for like the racetams for instance, which are like a really popular nootropic that talked about less nowadays in the rise of peptides. But I think that if you are asking for more from your brain by with some kind of nootropic, that might be a good thing, and that's helpful, might be helpful in the moment, but you're then going to have to let it recover more because you've asked for more from it, right? So I think there's this balance that's really tricky. So I don't generally recommend, there's no nootropics that I generally recommend, largely for that reason, either because there's a trade-off that I'm concerned about, or because we just use it to ask for more and more and more and more and more, and then we never we never allow the brain to recover. And the definition of nootropics would suggest that shouldn't be the case, but it is the case that unfortunately there's no free lunch in that area. And then ketones, like I'm super interested in ketones, both for recovery from brain injury. We study that in my lab. Also for cognitive decline and dementia. I think there are now several small trials, and mental health. There are several small trials that suggest some kind of ketone source, MCT oil, something like that, could be beneficial in those experiencing cognitive decline, because there's an issue of like energetic availability or energetic substrate availability in the brain. So I don't think we all need ketones. I don't generally recommend them. There's some evidence for some areas maybe of physical sports performance. So sometimes we use that a little bit in some of our athletes for like very specifically. And then, maybe in cognitive decline and dementia. But I just think we need a lot more evidence. People have been talking about them for decades, but like nobody's done a really good trial. So I'm just like, I'm desperate. I'm waiting for it because I think it could be beneficial for certain groups.
And pretty low risk, right?
Yeah, and low risk, right?
Yeah.
Humans like make ketones, like it's a normal thing for us. So then the next question was biggest bang for your buck exercise. I think basically anything that involves some kind of coordinative component, plus maybe requires aspects of agility and reaction and all that kind of stuff. So tennis, pickleball, dancing, surfing, like anything that kind of fits that mold, I think is going to be really important because it's going to require strength. It's going to require type 2 like fast twitch muscle fibers. It's going to require coordination, something like that. I think is going to be great. And then your final question was alcohol. So the short answer is 1 or 2 drinks once or twice a week doesn't seem to be an issue at all. But more than that, chronically, you may start to see some issues.
I think so many people are going to be so happy to hear that you just said that.
There's been like this real like puritanical push, like everyone's like, oh, you don't care about your health if you ever drink alcohol. Like the evidence does not support that. It doesn't. We've now kind of appreciated that alcohol in small, like regular moderate amounts of alcohol probably isn't beneficial for health. But I don't think it's as detrimental as we've recently been led to believe. But I think like if you're drinking every day, you've probably reached the limit where you may start to see some issues. But the occasional drink, I don't think is a problem at all.
Rad. Well, anything else that you want to share? This has been super fascinating for me. I know it will be for our audience as well. If there's anything else you want to let everyone know, where they can find your information, your book, or anything else you want to teach us.
Yeah. Thanks so much. So I think we covered almost pretty much everything. Like certainly all the big topics. The book is The Stimulated Mind. You can get it from thestimulatedmind.com or wherever you buy or pre-order books. My colleague Josh Turkner and he's a neurologist. We have a podcast called the Better Brain Fitness Podcast, where we answer listener questions. So if anybody has any questions disagrees with me about anything I said, please send us a question. We'd love to talk about it. That now happens largely through Substack. So if you go to betterbrain.fitness, that will take you to our Substack. You don't have to pay. There's the free version is the same as the pay version. When you sign up, you get a PDF of all the things I talked about in terms of nutrients and blood tests that are like critical, like the basics for brain health. And if you pre-order the book and you join our Substack and you just send me a message in the Substack and say, "Hey, Tommy, I pre-ordered your book," then I will send. I'm building out like a collection of goodies that I will send people, like some webinars, and there'll be a draw for people to like come and like visit us and come to a book launch, and I'll send some boxes of like sardines and creatine and blueberries or something.
I love it.
To some people,
our crowd is gonna love you so much. These are like 3 things they just adore. Stop.
But yeah, that's it. This is really great. I appreciate the being able to come and talk to you about this.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.